I really think it doesn't pull toxins out of your body. I think, if anything, it can give people a sense of relaxation because it stimulates the autonomic nervous system. And I think the burden of proof is on the people selling that, because I don't think they've ever truly proved that this colorful stuff that they see in the bathwater is even close to anything coming out of your body. So I have one of those. I tried it. I mean, I tried to figure it out, and I know good people who have, but people who really are students of this, and there's a study group I go to usually every 3 or 4 months, and we spend the weekend talking about things and asking each other, and really they read the world literature very intently. They don't use it. They do use sauna. The naturopaths use colonic hydrotherapy, which I have never had experience from, but claim that it's really helpful. The Gaia Herb program was developed by one of the main people in this group, Walter Crinion, and it basically just has the binding agent and herbs that just help support phase 1 and phase 2 detoxification. So. I have to first say that I don't have any expertise whatsoever. I clearly think it's something to be concerned about, and I'm generally looking for food products that don't have that in them, but I just don't know enough yet. I know there was one of the people who's in Germany. There's a guy, his last name is, I think it's Pop, but they've done, he's a physicist, and they've looked at organisms generate light, apparently through the movement, I guess, of DNA within the cells, and it's very, I would say, the expression of that light is generally very integrated. And when Germany was looking at introducing such products, they asked his group to analyze those genetically modified products. And they showed marked distortions in the normative organization of that light emission. Now, the idea is that we're ultimately energetic organisms, and that this disruption doesn't speak to a biologically healthy product. But I mean, and I know that there is science going back and forth very intensively, and I suspect those of us against it will lose, but at least I think some of us can keep looking for food that isn't modified. His wife had cancer, and he brought her to a fellow in Nevada named Dr. Brody, who is unfortunately deceased after a long life. And he used nutritional therapies, high-dose IV vitamin C, among other nutritional therapies. And he noted a decline in the benefit he was achieving with his patients. And when he looked into it, the vitamin C he was getting was sourced from genetically modified corn. So when he switched to a beet source that wasn't genetically modified, he began to see the same benefits he had achieved in the past. There are people who are made very ill by that, but the vast majority of the population isn't. So I think one always has to weigh the herd effect of mass immunization against the individual risk. And again, I don't feel like I'm a big expert on it. So if a person's fundamentally healthy and there's a real reason for them to have such a vaccination, I'm not a person who's against it. But I really don't feel like I've been convinced one side or the other. I think it would be nice to get thimerosal out, and I think in the vulnerable people it would be nice to have an alternative, and I believe more and more there is such an alternative. But I think I'm just practical about that, because I've seen harm done each way by avoiding vaccination or by having had them. Yes. I think the rules that as I understand them, and I may be incorrect, is that the FDA, I think, allows for a 20% variance in potency, high or low, on generic products. And so I think that, you know, for instance, with thyroid, you might get a product that has, if you're being prescribed 100 micrograms of thyroid, it's conceivable you could get a product with only 80, or you could get a product with 120 in one batch, and then the next time you got it filled, it could be totally different. I think that's troublesome. I know it used to be at Hopkins, they wouldn't allow their patients to have generic thyroid. I don't know if they've changed because of the economic pressures. It seems that the economic pressures are so great about prescription fulfillment that we've all caved into what's cheapest and what produces the greatest value for the pharmacy benefit managers. So.
How accurate are the hair tests for heavy metal load?
People use the hair test as a screen, and for certain things like arsenic, it's useful, but it's not as useful for other things. Like for acute exposures, it's not useful. So super acute exposures, it wouldn't be useful. It's useful for exposures between 6 and 12 weeks. But there are people, but the best test would be, in my mind, and what the people in this environmental medicine group that I study with feel, is that a baseline 6-hour urine followed by a post-provocation urine is the best way to look.
Thank you.